I'm not going to talk about it. These two are going to talk about it. So I'm going to introduce a few people before we begin. You know me. Liz is our office manager. She's over there helping people shine. She's from the medical side. Jessica, she is our registered nurse that's going to be running this program. And Will Schaefer, he's the one who's going to bring it to this area. And so we're going to be partnering up with him to do this. And he's going to talk about it today in this innovative treatment program all over that's can really help you.
I'm Will Schaefer. I got some of my brain in here because, well, I can't keep it all in here. I met you earlier, sir, and you're a farmer or came from a farm.
Well, I grew up.
Kind of, sort of. I grew up in Lewiston, Idaho. Grew up on a small fruit orchard down there. My grandmother grew up with, where I grew up with her, and she had type 1 diabetes. My grandfather did not really have a very healthy diet. He ended up developing type 2 diabetes. And so I'm somewhat familiar with this. I spent a number of years in the pharmaceutical industry, believe it or not, about 15 years. And so I've worked in the medical field and I've seen kind of the progression away from trying to understand why people get sick rather than, okay, you're sick, okay, let's give you some meds. And I don't think that's really the true way to go about taking care of ourselves. I think we really need to try to get well through nutrition and changes in lifestyles, and obviously maybe try to find why are we not feeling so well. I now have a number of things that I've kind of dipped my toes into, and when I came across this technology a couple of years ago, I was really amazed, and I started really diving into it and trying to learn as much as I can. I was connected with Dr. Kurtz here, and we started a conversation a few months ago, and I said, hey man, this would be really great. Would you be interested in doing this with me? He says, yeah, let's look and see if we can get this to this community, because there is a big need for addressing specifically the type 2 diabetes. Even type 1, this can help, and even pre-diabetes, this can help. And so hopefully this information today can help you better understand what it is, because it still is rather novel. I mean, it's been around for more than 10 years, but it started being adopted about 10 years ago in its process, and about the last 5-6 years, it's really started gaining traction. And like Dr. Kurtz said, it's been about 200 clinics or more in the United States are starting to do this. We're starting to put some new pressure on with the new administration of really taking note of, hey, we have an issue here, we can't ignore this. We need to really address the baseline issue of what's going on with these diabetic patients. And so we're hoping to share some of the technology, in a sense, of how it's delivered. Ask questions, please just raise your hand. I'm happy to do as best I can. I'm gonna preface this by saying that I am not a medical doctor. I am not a medical professional, so please, you have to take this information as best you can. Educate yourself and talk to your doctor about this. But I'm hoping I can share as much as I can to get you interested, because I think it will help each and every one of you who are suffering from this condition. Can I raise the hands of type 2 in here tonight? Type 1s at all? Okay, we did advertise mostly type 2, so we think that is the biggest need right now, for sure. Who suffers from neuropathy? Does anybody have any terrible stories about how it keeps you up at night?
Leg cramps.
Leg cramps? A lot of burning, anybody experience a lot of burning, kind of the shocking feel? Yeah. Diabetic ulcerations, like foot wounds, leg wounds, on occasion. Yeah, those are not fun. I hope my grandmother, treated a few of those over the years. So, but that being said, let's just jump into it, shall we? So, what is PIR? It's physiologic insulin resensitization. So basically, insulin therapy. So what we notice is that with diabetes is that we have insulin resistance. That's what's going on at the cellular level. So what's going on, we'll show you here a video in a minute, kind of an animated video, probably does a better job of explaining it than I can. But basically your body with your pancreas and your liver function has become unbalanced to where your cellular masses, like your actual cells, the gateways for the insulin receptors are not receiving the insulin anymore. And so therefore your cells are not opening up to receive the glucose. So that's why you have high blood sugar, because the glucose is not being absorbed into the cell masses, it's just floating through the body. And so you're not getting those energy spikes, those energy needs that you have. And that's why a lot of times people feel tired, say sometimes. And so what we're trying to do is really reestablish this. So if you look at the first slide on the left, this is how your pancreas functions normally. So it's almost like a heartbeat. And so you have this normal process of insulin release, calm down, insulin release, calm down, insulin release. If you look at the middle slide, see it's all out of whack. There's no normal pattern. It is dysfunctional, might be the best way to put it. So what might happen is you can have a giant release of insulin over a long period of time, and it's just bombarding your body with insulin. But your cells are just saying, whoa, hold on, I don't need any more insulin. And then of course it creates kind of this damage to the cell to where the cell doesn't want to receive the insulin receptor, so the insulin to the receptor site, and then allowing the glucose to enter the cell for the energy that you need. What we're trying to do with insulin resensitization is we're trying to resensitize the actual cells. So this isn't insulin like you would normally think of using insulin. Who here uses insulin? Okay, quite a bit of you, yeah. So that is a drug dose of insulin. And what we're trying to do, or the physicians are trying to do when they give you insulin, is trying to get a maximum amount of insulin into the body to counteract the glucose levels in your bloodstreams. But it's still not helping with your cells to basically heal, so that your cells can recognize the insulin as a hormone. The way that your body produces insulin is more like a hormone, it's not a drug. So it's more like a signaler to your body, to your cells, to say, hi, we need to absorb some glucose into the cells now so we can make some energy. And so this gets all out of whack. So if you look at the last slide there, with the peaks in the red, that is what would be part of this insulin resensitization treatment that we provide you. So we're trying to get the patterns of the heartbeat back to where the body starts normalizing and saying, okay, I feel like this is a hormone again. And I'm starting to receive it, my cells are receiving this signal to start using glucose in a normal way. So that's the basis of it. We're going to show you a little video here. They do a really good job of doing this. So we got this from another clinic from across the United States, and so take a look.
You're struggling with symptoms related to slowing metabolism due to diabetes or other metabolic disorders? Here's some common symptoms. You don't have energy like you used to. You look at kids nowadays and can barely keep up with them anymore. Exercise has become seemingly impossible. No matter what you eat, you seem to be packing on the pounds. Your whole body has begun to ache. Your feet, legs, back, everything. Your memory is starting to fade. Your vision is beginning to blur. And you find yourself frequently having to rush to the bathroom to urinate. Your body just doesn't seem to be working the way that it did when you were younger. Your once fast metabolism seems to have slowed to a crawl. Sound familiar? Let's take a look at what's going on inside your body, one step at a time. When we eat food and digest it, our bodies break it down into glucose, often called sugars. Glucose is used by the cells in our bodies to make energy. Your cells work in conjunction with the pancreas, which makes insulin to do this. Think of your pancreas like a locksmith, insulin like a key, and your cells having a door that opens and closes. When your muscles and organs are hungry, they send signals to the locksmith to create keys to open the locked doors for the glucose to enter. It's important that your locksmith makes keys at the same pace as the signal that is sent, keeping the process synchronized just right, like a heartbeat. But if you have a metabolic disorder or diabetes, the process isn't so smooth. Over time, some of your cell doors can become stuck shut. When this happens, extra signals are sent to your pancreas locksmith to make even more insulin keys to try and unlock the doors. This causes your pancreas to work overtime trying to keep up with all the signals it's receiving. Unfortunately, more insulin causes your cells to lose sensitivity and keep even more doors closed for even longer, causing the glucose to pile up and make your blood sugar rise. The loss of cell sensitivity is clinically referred to as insulin resistance, IR. Eventually, your pancreas overworks itself so hard that it burns itself out trying to unlock the jammed cell doors. Most of the glucose in your bloodstream can no longer get into your closed cells. Not only does this mean your blood sugar will rise, but now your cells cannot convert the glucose into energy for your body. The rhythm of your locksmith, keys, and doors has been thrown off balance, slowing your glucose metabolism to a crawl. So what can you do? When you reach out to your doctors, they do their best to help you manage your symptoms by suggesting diet, exercise, and prescribing medications. Unfortunately, not all doctors are familiar with the right tools to address the root cause of the symptoms you're experiencing.
So hopefully my nice little character there made a little bit more sense, but does everybody kind of understand how the way that this works, the mechanism of action? Any questions so far? So basically what we're trying to do is we're trying to resensitize the cells at the cellular level, and we're trying to get your body to normally accept glucose rather than rejecting it, because your cells are basically saying that we are not sensitized to insulin anymore. So we're trying to get your cells to recover that normal functionality. And with that, you're actually going to start seeing recovery of tissue within your organs. So neuropathy, for instance, we've seen upwards of 98% reduction in neuropathy with this treatment. 98%. We're going to show you a couple of testimonials here pretty soon about that. But yeah, go ahead.
Pardon me, neuropathy is what, please?
Basically, neuropathy is, from a simplest standpoint, is that you have these shooting pains or vibrations or electricity through your lower extremities. It prevents people from sleeping. It's terrifying. Whoever here is dealing with it, they can tell you it's very debilitating.
Okay,
They can just
thank
be sitting there. I thought you were wondering like the actual physiology, because there's
No.
debate on how it actually comes about. So, the other thing is that with chronic kidney disease, I actually just got off a call with the CEO/physician of the Comanche tribe centers, and he was saying that he's had 89 patients with stage 4 or stage 5 chronic kidney disease. Those 89 patients have reversed kidney disease. Really cool stories. In addition to that, you'll have some additional literature talking about potential reversal of fatty liver disease. You'll have your pancreas will start to heal. I wish every single person responded this way, but obviously some people won't respond. We're hoping that this will work for all of you. So there are some additional instances of people saying that they've had pretty drastic reduction in weight. They're significantly more energy. They want to get back and exercising. Vision improves. There's a lot of things that can greatly help you. We do recommend that if you were to start this treatment, that obviously use this as kind of a springboard to feeling better. And if you feel better, then you want to get out and take that walk. You want to get out and start exercising. You want to start eating better. We've also seen reductions of the average of around 3 to 4 medications that people are on, down to just maybe 2 or 1. Your A1Cs will drop. You're just going to feel a whole lot better. So, we can go on to the testimonials. Oh, let's go to the testimonials first and we'll come back to this.
Sure.
These are just 3 patients we found from, again, these are different clinics across the United States these patients are from. These are not our patients here. Again, we're looking to bring this technology and treatment to you, but these are their stories.
One of our awesome patients who's in the PIR therapy, guys, as you know, that's short for physiological insulin resensitization therapy. And so tell us, how many treatments have you had so far?
I just had 2 from last week, and this is my 3rd one.
Okay, perfect. And what we are working on here with the PIR therapy is actually addressing his diabetes, but as you guys know, there are many complications, neuropathy being a big one. So, and neuropathy, was that the main reason why you came to us?
Yes, sir.
Fantastic. So tell me kind of what you noticed happened with your neuropathy.
Okay, to start, before I take this treatment, it was a lot of burn, a lot of pain in by my toes, and it was intense. And last week that I take those 2 treatments, this weekend, I enjoy myself. Even my wife was surprised because she don't hear me complain. I was really happy about it.
Wow, wow. Awesome, awesome. Well, thank you so much for sharing that story with us, and we look forward to seeing this long term.
My feet had gotten so bad, I was wondering how much longer I was gonna be able to walk. And it had gotten up to where, like over my calves, I couldn't feel anything. Talking to the doctor, I said, well, it's been 20 years since I noticed it. Another 10 years, it's gonna be above my knees, I'm probably not gonna be able to walk. He said, I think we got something that might just reverse that. It seemed like it wasn't doing anything for the first couple of 2 or 3 weeks, but then all of a sudden it started when it was happening. It's like everything is going in reverse at high speed. It's like rewinding a cassette tape. You know, the feeling is going back. A lot of the burning, shooting pains in my leg, they're all gone. I still have the numbness in my feet, but not as bad as it was. And at this speed, it seems like it's not gonna be long. The way it's going, I may be having control of my feet again. And it's not just my feet now, I'm noticing. And now my hands feel a lot better. I got just a little bit of numbness in my fingertips now. My vision has definitely gotten better. There's no doubt about my vision. I hardly wear glasses at all now. Something that doesn't really matter to me, but I've told the doctor about this too, is I've noticed my hair is growing more. I was talking to my cousin the other day. It's kind of like taking a drink out of the fountain of youth. You know, because all of this stuff is coming back. The feeling in my feet and the numbness is going away, my hair growing, and you know, my eyesight, you know, my balance is coming back a little bit, you know, and everything. It's all like a rejuvenation. Like I told the doctor, I said, it's like you're tuning me up for the second half, so to speak. You know, of course, I know I'm in the third quarter, but we'll go with that. The neuropathy in
My name is Mary Ann Giles, and I'm 72 years old. I have had diabetes for 20 years, and up until last April when I started at Diabetes Relief, my blood sugars were totally uncontrolled. They were usually over 200. My fasting blood sugars, I was taking 60 units of Lantus every day, plus supplementing it with Humalog several times a week. My feet would not heal. I had neuropathy, I felt nothing, and I had the tips of 2 of my toes amputated. I was extremely overweight, and I had no energy to do the things that I needed to do or wanted to do. I've been coming to Diabetic Relief for a little over a year. My blood sugars are now controlled with 30 units of Lantus to be under 120 all the time. And sometimes I do not need any insulin at all. I'm completely off of the Humalog. I have so much more energy than I have had before. My feet still get some sores on them, but they heal really quickly. It used to be 6 months, now it's 4 to 6 weeks. I haven't seen my podiatrist for several months, and I used to see him every single week. When I started Diabetes Relief, I weighed 71 pounds more than I weigh today. And I credit them with, first of all, giving me the energy to exercise, and also, as my blood sugars leveled out, my cravings for sweets kind of disappeared. And here I am a year later. 71 pounds lighter, almost lost my age. My blood pressure has gone down, and I'm off one of my blood pressure medications as well. I truly believe, as does my family, that Diabetes Relief saved my life. I was just going down a path of becoming sicker and sicker and having less energy and wanting less to do things. And I'd have several bouts of problems with my kidneys, and I really felt like these treatments got me through. I feel healthier, I feel happier, and like I have a new lease on life. I'm a different person. I highly recommend it to anybody with diabetes.
One thing that she spoke of that I really speak about was that with those ulcerative wounds, specifically on the feet, they can be really problematic, and a lot of people experience having to have a toe removed, amputations of the lower legs, even below the knee can happen. And with this treatment, a lot of clinics across the country have started using this and said that they've been able to avoid a lot of amputation, which is fantastic because nobody wants to lose any part of the body that I know, not even a tip of the toe. So just it doesn't feel well. So that's her testimony is really amazing to hear that as well. Kind of getting into what this is and how it works. Jessica's she's gonna dive into kind of what your appointments would be like. But basically, it is you're using fast-acting insulin, but it's in a controlled microdose pulsing therapy. So it's through a controlled pump. It's an FDA-approved portable pump, and you will start with likely a treatment about 2 times every week to start. Is usually what happens, and then we do that for a few months, or a couple of months. We monitor your progress, and then we drop down to about once a week or once every other week. But eventually we get you onto a program where you are literally only in about once every 3 weeks to 4 weeks for just one treatment when you're on what we call the maintenance phase. And that's when, probably will be able to stop using insulin. In all honesty, we may not have those results, but that's our goal. And drastically reduce the number of medications that you're using, avoiding amputations, reducing your neuropathy so you can sleep at night, improving your vision. All these things are possible, but part of it is really committing to the process as well. Every clinic that I've talked to across the country that started this says you gotta get the patients to really commit to their own well-being and coming in for those regimens and really doing this stuff.
So, is this like a lifelong process that you go through, or is it
Yeah,
structured for, 2
First,
years, 3 years,
yeah.
or whatever?
From what we know so far, because of type 2 diabetes being a chronic metabolic condition, is that once you achieve a type 2 diabetes, you never really can shed it. Now, there is some nutritionists out there who will say that if you eventually get the proper nutrition, you stop all of bad habits of eating, you said you like cake. And some people say that you might eventually be able to stop all therapies, but right now the data doesn't suggest that. So yes, the idea would be that for all the years in the future, something like this, or if you're not happy or if you think it's too much of a burden, you can always go back to Richland. But I don't know many patients, and I haven't heard many testimonies from people across other clinics saying, yeah, I want to go back to taking 4 meds and giving myself insulin and having no energy. People love this, and if they can come in for just once a month for a couple of hour session, sit down, read a book, take a nap, watch a movie, whatever, have a good conversation with Jessica. She loves talking to people, and it's up to you. It's up to how you want to treat yourself.
I know for type 2, a lot of the prescribed treatment is like Ozempic and Mounjaro. Isn't that kind of the same thing?
No, this is unique to itself. So basically what we're doing is, the technology is doing is it's delivering insulin as your body would produce insulin. So it's basically reducing or supplying the insulin as a hormone rather than a drug. So it's creating a normal metabolic state for how your pancreas should function. And ultimately, we're trying to get that pancreas to, in essence, wake up, behave itself, and function normally. And it's kind of like, I don't know, kind of like jumpstart your car. In essence, where you're trying to get that car to get going again in the right way. So no, it won't replace those medications, but you may not need the dependency on those medications. Does that make sense?
Because they want to try and put me on, I haven't yet, so this
Yeah,
will work.
yeah, I totally agree with you. I mean, I like I said, I spent about 15 years in the pharmaceutical industry, and I saw things I didn't like. That's why I got out. And I've actually, the last 5-6 years, I've really been trying to get on this path of how can I use, you know, my knowledge and my passion to help other people, trying to get people back to a more healthy lifestyle, whatever ways that is. Nutrition, something like this is more of a natural treatment. So people get their lives better. Yeah, yes, sir.
Does Medicare pay for this?
Medicare does pay for this at the time. Advantage, we're gonna have to get probably some prior authorizations through, but we'll make sure that we can check with your insurances. And some commercial insurances do cover this as well.
Is there any side effects to this?
Yeah, so as long as we're doing it right, and Jessica's really good at what she does, you shouldn't have really any major side effects. You know, they've had some reportings of like, you know, upset stomach at times, dry mouth. You shouldn't experience any hypoglycemia effects because she's gonna have glucose with her, and you'll get constant monitoring during your process so that you don't have a crash. So she'll be doing, we're thinking of probably doing CGMs, or finger pricks to just monitor you as your process is going through treatment. So she'll be able to see if your glucose levels are dropping. We'll do some oral glucose in kind of a gel form, just to keep you steady. Yeah.
How long does an appointment here take?
About 2 to 3 hours.
Okay.
Like I said, bring a book, watch a movie. But a lot of people say, you know, yeah, it can be a burden early because it is a commitment, especially for the first couple of months, if you're coming a couple days a week. But once you get onto that maintenance path, it's all worth it. Yes, ma'am.
Do you still take your prescribed insulin?
Yeah, you would need to continue taking all your current medications, working with your, I'm guessing most of you are working with a primary care physician, maybe an endocrinologist, and monitor your progress, and then have the doctor make a decision on how you can titrate down from those medications.
Is it more effective, like if you've been diabetic 1 year versus 40 years?
No.
Is
there's no,
it more
I think,
effective or?
yeah, so
just the same?
your dosing and how Jessica will be dosing the medication during your visit will be different from anybody else. It's gonna be based on your readings, your A1Cs, and other your glucose levels, things of that nature. So no, somebody who has 1 year will not respond faster than somebody with 20 years. But the dosing and your pulse rate of how quickly you're getting your insulin, whether it's every 3 minutes or 7 minutes or 8 minutes, will be dependent upon your disease severity.
So if this was prescribed when you're diagnosed, is it, when you're first diagnosed, is it,
Oh, I see what you're saying.
Yeah.
You could get to the maintenance phase quicker, absolutely. That's entirely possible. And also, I mean, if you really wanna go gung-ho and never eat another carbohydrate in your life, and go purely to a vegetable/carnivore diet or other options, get out there and exercise more, you're only gonna speed up the process. So, yes, sir.
How different would it be for pre-diabetic?
As far as your treatment,
Yes.
it would be the same. But it's just monitoring your glucose levels, monitoring your A1Cs. Again, you'd probably get to your maintenance phase way quicker than a type 2. Yes, sir.
You said monitor your A1Cs. Is that done here?
Yeah, we would do that as well.
Okay.
In addition to that, you know, your primary care physician would also be
Right,
monitoring them also. Because they're gonna be the ones who ultimately are making the decision on which meds you continue, titration down on your med dosing, etc. Jessica's gonna walk you through what an actual visit's gonna be like, and you're hanging out with her.
Okay, so some of you may be wondering what it's gonna look like to come in for an actual appointment here in the office. So let's talk about your patient experience. Overall, our goal is to really make it an easy process for you guys. We want you to be comfortable with the process and whoever you're dealing with in office. You'll arrive, we'll bring you back. We have a designated room for this procedure. We'll have comfortable chairs set up, and you may be treating alongside patients such as yourself. We can talk about the consultation. This is when you're gonna meet with a provider. This is really important, where you're gonna establish a care plan that is very specific and tailored to your needs. You'll do a thorough exam and history. You'll talk about your diabetic concerns. A lot of people, as we talked about, deal with neuropathy is a huge issue. You might have vision problems, diabetic wounds or ulcers, and all of these things, you know, we're working to heal or improve. As also mentioned, we want to get your baseline labs done. So we'll look at your A1C, and that'll kind of tell us about your progress. In the actual treatment itself, you'll come in, like talked about, up to 3 hours, kind of a long time, we understand that. I will go ahead and start an IV. We will do an assessment as well, and then we'll take your baseline blood glucose level. That's really important. And we'll follow the protocol that the provider has set up for you directly. Throughout, we're gonna be like he talked about, Will talked about this, we're gonna kind of find that happy medium between titrating the insulin and your blood glucose level. So we will continuously monitor that blood glucose level throughout that time. And we want that to stay safe, of course. Now, talking about the protocols, individualized per the patient, that's really important. Everybody's got their own plan, everybody's different. You may expect to treat twice a week to start off, and then we're gonna tailor that, of course. You may move to once a week. You may move to once a month. That's really gonna depend on your progress. Things that are important to take into consideration, subjective and objective findings. So, you know, you'll be you'll be checked out by me, and I'm gonna be able to assess and decide what we're seeing as far as changes go. And then you're gonna have things that you'll tell me, how are you feeling? What's making changes? What are the differences going on? We want you to be cozy, come in, relax. We talked about maybe bringing in your favorite book, an iPad, really get comfortable and ready to stay put. A lot of people come in and socialize. You're gonna be dealing with a lot of people that are going through the same things as you. Also, lots of time to talk about education. This is really important in managing your diabetes. So we might talk about your diet, go through education in regards to wound care, things like that, and wound care assessment and how to manage that. That's gonna kind of give us more of a comprehensive approach to your health, and that's really important. We truly are trying to aim and provide you guys the tools to make big changes in your health. We want you to take charge of your health. We want you to make these goals, to optimize the outcomes, and we're here to support you. We want to be that support system throughout this process, and be a part of the improvements that are made. We want to see change in the quality of life for you guys. Also, let's see, so next we'll talk about coordination with primary care. So this is gonna be really important to work hand in hand with your primary care providers or your PCP. We wanna talk with them and figure out the safest plan for you. Essentially, this is a huge deal when it comes to the medication, right? So medication management is gonna be in the hands of your PCP. So we wanna work with them as you may need to decrease your usage, as Will talked about. And so lastly, patient safety, super important for us here at the clinic. We just wanna emphasize the fact that this is always gonna remain a top priority for us at the clinic. We want you guys to feel safe. Things like a rigorous training program are in place. We're gonna have specific protocols for each individual, and then we'll have the dedicated staff to take care of you guys. We just want you to feel at ease and safe throughout this process, and that's really important to us. I can say I'm truly excited about this new technology. I think it's really amazing. I'm excited to build relationships with the patients, and just to make a difference in the community overall.
Yeah, any questions still?
A couple more things here too. These are some things to look for in the future. We may add to the clinic: IV infusions, wound care, peptide therapy.
Ideally, we could actually Jessica's excited about this as well, is, while you're sitting in the chair, she has 3 hours, 2 hours or so to look at any sort of maybe lower extremity wounds you might have. Talk about what you've been going on, as far as frustrations, is it not healing, is it new? And we could have some good therapies for that as well. When you're sitting in the chair, you might as well get a wound dressing, so it's an idea. So who here is tired of being sick and tired?
Sure, but.
I'm glad. Yeah. Well, thank you for everybody for coming. We hope that you will reach out and ask more questions and possibly gain an interest in starting with us. We're gonna have a limited number of chairs to start. So obviously first come, first serve, and we'll hopefully get to all of you. It would be really awesome.
When is it starting?
As soon as we possibly can. We need to send Jessica down for training, make sure that she's fully optimized and safe for you, like she said. When she gets back in probably about a month or so, we'll be ready to rock and roll. That's our goal. But, you know, things happen, snafus happen, of course. Yeah.
Do you guys have a list of like, other than Medicare, what insurances would cover it?
Yeah, so from what we know right now, Aetna does, we hear this Cigna does, United is not plan friendly. Medicaid, we don't know right now with the state of Washington. We're going to have to check on that. I have a list of a clinic over in Seattle. I'm gonna call them and ask them about that one as well. Medicare does, obviously. The Advantage plans will likely cover it. We just need to check on the referral and the authorization on that.
Blue Cross Blue Shield.
From what I hear, Blue Cross Blue Shield does, but I need to double check on that as well.
Now they cover a whole bunch of stuff.
Yeah, on their website, they actually talked about this therapy and they actually provided some coding assistance, and so I think they're gonna be just fine. But again, we're hoping to do some prioritization to make sure.
Do you have a handout?
Yeah.
Two questions, if I may. First, how do you determine success of your treatment? I mean, what criteria is
Sure.
used?
Everybody's gonna respond differently. So for instance, you saw the first gentleman, he said, hey, the first week, I'm already, my neuropathy's already improving greatly, I'm sleeping. Second guy said it took, what was it, 3 weeks before he started seeing any improvement in his neuropathy. The other lady, obviously for a year, she'd been probably following everything the doctor said. So it's gonna be up to you, because that's when we're gonna need your feedback, to say, hey, here's what I'm experiencing with my neuropathy, if you're dealing with that. Wound closure we can actually do. We're actually gonna be monitoring your wound closure, so we'll be measuring the diameter of the wounds as we progress. And same thing with your A1Cs, we'll be monitoring that as well.
May I ask what your success rate is in general?
We're bringing this on as novel, but I can only speak to stories and clinical experiences that other clinics have had across the country. And every single one that I have called, and I'm happy to give you more references if you want those, they just say it's changing people's lives. But there are some patients that don't respond as well. From what I've heard from all the doctors is that everybody does respond. To what degree is your own physiological makeup is different from anybody else.
And I assume it's FDA approved?
Yes, the medication is fast-acting insulin, so it is approved, and then the pump is also approved as well, yes.
And the last question, how come I've never heard of it?
Exactly, no, I'm not laughing at you, no, and the reason why I'm laughing is because if you've been watching the news and if you're much like me, I've kind of lost faith in the medical industry. I really have. When I found out from an interview that I was listening to that the insurance companies bought all the pharmacy benefit manager companies, which were intended to be developed for us in 1973 for our protection from the pharmaceutical companies, keep our costs down on medications. When I found the insurance companies bought the pharmacy benefit managers and have taken control and now make 70% of their profit through pharmacy benefit managers, I lost all that. And so when the doctors, in addition, when they go through medical school, the way that they're taught is not world medicine, it's westernized medicine, where they say, okay, well, you have cancer, here's some chemotherapy. Well, why do you have cancer? Did you smoke? Maybe stop smoking. You know, or if you've got diabetes, okay, you have diabetes, here's these medications, let's try these, rather than let's maybe try to work on your nutrition and reversal of lifestyle changes, things of that nature. We've stopped treating why people get sick. We're now like, okay, you're sick, here's some meds. And so that's Westernized medicine. That's why you haven't heard about this, because what they're taught in medical school is when you see a patient with type 2 diabetes, start them on this protocol. That's all they know. Trust me, I know. I spent 15 years in the pharmaceutical world, and it is all about, I've been dealing with this, here's a good med for them. It's that.
May I ask who the originator, I mean, who? And
That is a
how
great
widespread-
question. It was a gentleman out of Europe. And he started with just the idea when you go into the hospital, if you have a crash, they put you on an insulin drip. And they do a slow titration insulin drip. And he's like, well, why can't we use this in an outpatient setting? So he started building this process of microdosing insulin over years and years. And he did this, it was like 25, 30 years ago. What was his name? It's a baby. But then they finally fine-tuned it, and they've actually learned how to really do it right.
You answered it partially, but how come, I guess my question is, why didn't our MD tell us about it?
Yeah, it's a great
I
question.
mean, we
He doesn't know.
considerable
He doesn't know about
expense
it.
over a period
He
of
doesn't know
time.
about
which
it.
is
doesn't make any money off of it.
And again, like I said, it's when you go to medical school, the doctors are given literal protocols. So for diabetes, cancer treatment, high blood pressure, high blood pressure, they just say, okay, here's some statins, here's some meds. They don't say, well, hey, let's go get some exercise, let's start eating leafy green vegetables, let's get away from sugars. They don't do that. Granted, medications help, but they shouldn't just be the default for everything. And again, this isn't a medication treatment. This is a hormone treatment. It's using insulin as it's a medication, but we're using it and we're titrating and we're pulsing it as a hormone. So it's acting like your pancreas should be acting, and it's trying to jumpstart that pancreas to start working normally.
Doctors want to get you in, get you out. I'm sure you guys have been there where it's like a 15-minute appointment. You're like,
Well,
I didn't even talk to him.
That might be the only other
What
reason as
happened?
well. So this is a 3-hour treatment.
Yeah,
It
they
does
don't want
not
to get into
reimburse a
you
lot.
should do this, you should do that, because they got to see the next patient in like 5 minutes. It's, and I'm not saying anything bad about MDs. There are some great ones, but the reality of it is they see patients like every 15, 20 minutes. They don't have the time
They have to.
do that. They have to,
They have to.
yeah.
Well, if they're part of an organization that says you have to see so
Exactly.
many patients in that.
Yeah.
Well, not only
Yeah.
that, but the CMS, everybody familiar with CMS, Center for Medicare Services, they provide all the code sets for everything in the United States, and all the private insurance companies follow the CMS code sets. And so basically, there is standards that say, well, you cannot spend more than so many minutes with a patient, because that's what the code set allows for.
Yeah, or we'll drop you.
Unbelievable. And also the reimbursements are so low that the doctors have to make up for volume rather than quality time, like we used to have doctors back in the 70s and 80s, where you used to go sit with your doctor for 20 minutes and have a conversation. Hey, how's the family? No wonder why you're stressed out, your wife's driving you crazy or something, I don't know. What's going on, sir? Yes?
If you don't believe that the pharmaceutical world is running your life, treat yourself to a 30-minute view of any television station in the evening and count the number of different pharmaceuticals that are for sale for everything from sex problems right on down the list. They got a cure for it all. Here's a tablet. If that doesn't work, come back and we'll give you another one. Now, do I need a referral from my endocrinologist to visit you guys? You may.
We'll work with you individually.
Okay. And you're talking about kicking off in a month?
We're open to, yes.
Perfect.
Yeah, it's funny, we're one of only 2 countries in the entire world that allow pharmaceutical companies to advertise directly to consumers. Unbelievable.
Yeah, we did away with cigarettes, but we're allowing pharmaceuticals to
Yeah, it's sad.
advertise.
Yes, ma'am?
I have United Healthcare Advantage, and if they don't cover it, about how much would that be out of pocket for me?
It's about $250 to $300 is what the reimbursements are per session. That's a 3-hour session. So we could work with you though.
Yeah.
And again, it's not necessarily a no from United. It's just when I talk to other clinics across the country, they say they're just the bear to work with, but you never know. You're familiar with local coverage determinants? Probably you guys don't know about this. So the country's split up in multiple zones. They're called LCPs. We're in the Meridian Zone, and so the Meridian Zone may be different than the people I've been talking with, Texas, Connecticut, Pennsylvania. So this is fairly new on the West Coast, believe it or not. Everything starts to go serious. It always does, but we're always happy to check for you. You never know.
Do you take care credit?
I do. We do.
So are you talking and educating doctors about this, or just going to patients?
Well, what we're hoping to do is launch the program. It's quite expensive. That's why Dr. Fritz and I are partnering. Hoping to bring the actual program in to fund the program, because I don't have a medical license, as I've told you guys, but I'm really excited to help people. And I kind of had like epiphany like 5-6 years ago. Like I said, I was really tired of just playing the game. I want to start making real changes. So I can't do that without a doctor's help. I mean, he has physicians here to help do that. So I'm really excited to get this going. But to fully answer your question, that's part of our goal is for me and if I can get Jessica up to speed and a couple other nurse practitioners here to go out and actually talk to a lot of the primary care physicians in this community and educate them. Say, listen, we're not trying to take your business, because that's kind of how they feel about it sometimes. We're not trying to take your patients. We want to work with you with your patients. And we'll take that burden off you having to treat them, because it is 3 hours. Hopefully we're going to get it down to about 1.5 hours, 2 hours, just some new advancements in the technology. And so some of these physicians, the scientists, the mad scientists behind this they're saying, yeah, we think we can actually reduce this down to maybe 1.5 hours, which would be really awesome. But it's typically between 2 to 3 hours.
So I'm trying to understand, you say that it helps resensitize the cells, and you're able to decrease the number of treatments or sessions.
Correct.
So doesn't it follow if something's desensitized that ultimately they should be working? Or-
So yeah, are you familiar with receptor sites? So yeah, for instance, our bodies have a ton of opioid receptor sites throughout our body. We also have cannabinoid receptor sites for marijuana. We have more than those than opioids, which is kind of I always find fascinating. But we also have insulin receptor sites on our cells as well. But the problem, what's happened with the damaged pancreas, is it's bombarding the cells, and so the cells are like, yeah, I don't want insulin anymore, and that's what's going on. And so instead of your cells having these open receptor sites, these receptor nodules, whatever you want to call them, these receptor bays for the insulin to attach. And what that happens is when the insulin attaches to it, the insulin isn't going into your cells, by the way. That's a misnomer. And so what happens is it gets to the cell, and then the receptor goes, hey, great insulin, let's consume some glucose. And so your cell membranes actually open up and allow the actual glucose to be absorbed through the cellular membrane into your cells, converting energy. So that's what it does. And so by doing this, we're trying to slow down the insulin bombardment. We're trying to give it the peaks that it's used to and the valleys that it's used to, the peaks that it's used to and the valleys that it's used to, so that your cell feels like it's a normal metabolic process.
But it's only twice a week, and our bodies.
Right, and so they're still trying to figure this out, right? And so again, this is fairly new within the last 10 to 15 years as far as really going in the outpatient setting. What they found is that the optimal times is about just a couple of days a week. In addition to that, you probably just couldn't come in every day, 3 hours a day. It just probably doesn't make sense for everybody's life. So.
It's similar to kidney dialysis. You only need it 3 times a week.
Okay.
And the problem with kidney dialysis is you're not healing the kidney's dying. This is actually healing the pancreas, and that's why you need less and less of it over time. That's the goal.
Healing the pancreas, it's healing the kidneys, it's healing the
It's
liver,
healing
it's
everything.
healing your
It's
eyes,
getting
it's
your-
healing your blood vessels.
You're getting your body to work. And you're also going to be working on, Jessica's going to be teaching you about better nutrition, losing weight. It's a whole, she's got a captive audience for a couple hours. She's going to let you have it, so.
You can't run.
You can't run. You can't go anywhere.
Yeah, I was talking to Dr. Kurtz. I said we had multiple conversations, like I said, over the last few months, and I think we share the same dream of really creating a regional diabetic care center where you can come and heal, and it's more than just this treatment. It's helping with your wounds that aren't healing. It's helping with nutrition. It's helping with exercise guidance, and ultimately, even with the mental stuff, is possibly even bringing in some mental guidance. Of, like, I know it sucks. Keep going. You got this. Or let's talk about in the past. Like maybe why are you comfort eating? For that's a problem with some people. We comfort eat from distress. Maybe we can unlock some things going on in the past. Our whole goal is to get everybody just to be healthy again in the community. And regionally, we think we can do these with these pocket areas such as the Tri-Cities and Yakima and Walla Walla and Lewiston and I'm so excited to bring this back to my hometown of Lewiston, actually. And also the tribal communities as well. They're the most afflicted communities in the country with diabetes. The second one is the African American population. You ladies know what I'm talking about, right? It's terrible. And nobody's trying to help anybody. Everybody's just trying to make a dollar on the pharmaceuticals. So we're trying to do something right. Hopefully it works out. Yes, sir.
Very politely, I would like to tell you, I would like to be your first patient here. Who do I talk to?
I'll take care of you, we'll talk.
Any other questions?
I was curious how that insulin therapy, how it applies. I don't take insulin.
Yeah.
You know, they do have me on Jardian.
Yeah.
But
You don't have to be on insulin to receive this therapy.
okay.
We actually hope you haven't progressed to the point where you do need insulin, because that's pretty much the doctor's last
Right.
resort.
Because I mean, all the
Yeah.
things you describe about,
Yeah.
you know, tired,
Right.
all these things I got except for having to take insulin.
Yeah, and it's still because the metabolic process within your body, the way your pancreas is acting along with your liver, it's out of whack. That's the way to put it. It's just not working right. And the process begins with the signaling from the pancreas along with the liver working in foods to send out the right dosing of insulin to your body. And like I said, kind of like the heartbeat that they said in the video. And so by doing this, we're normalizing the insulin release, the metabolic function of your body. And so hopefully you don't have to progress to using insulin. If you get on this, the likelihood of you progressing to insulin use is probably going to be minimized. Can't make that promise, but we're hoping that's what happens.
Well, I've tolerated bad knees for several years now, and they won't touch me for a knee replacement until I ditch another 50 pounds.
This is possible.
Well, yeah, I'm up against genetics on that one, because
I was talking to, I live up in North Idaho, and I was talking to a nephrologist up there, and she's really excited about this. It's just that the community's so small. We don't know if there'd be enough interest, but we think there might be. And she was talking to me about, because I was talking to her about neuropathy, she goes, oh, well, yeah, it goes, duh, it works in the kidney. She goes, because neuropathy in a lot of occasions is basically the blood vessels working in the tissues, not supplying them enough blood to basically the nerve endings to create healing sensations. She goes, so yeah, that same thing affects that in the kidneys, is what she was saying. So like your blood vessels are constricting, so your kidneys are getting choked off basically. She says with this therapy, there's a possibility that it kind of wakens up and heals the kidneys.
Is there any connection of this to macular degeneration?
Possibly. We don't know though.
More diabetic retinopathy.
Diabetes, it's all the little vessels in your eyes, all those little ones.
So yeah, but we don't know. Could be, but we can't say that. But you're right, it's the diabetic.
Do you have links to the scientific studies that we can share with our doctors?
We're thinking about posting some of those onto our website, so that you can do some more deep dive research. We're just deciding which ones we want to put up there. That's a good question. Thank you.
Well, I think it makes people think.
Yeah.
This really does
Yes, ma'am.
make people think.
Yeah, we're hoping if anything, it makes you think, and please go do your own research, and we'll provide as many links on the website as we can. Maybe just wait for that to pop on in a week or so. I'm working. Alexis is, thank you, give her a round of applause. She got everything out, she's been working overtime to put all the information on the website, and get all y'all interested, so we can come in here and hopefully get some more education. Thank you for coming, really, I hope this is something you can take next step in your life. Hope you guys feel better.
Okay, guys, are you ready? Yeah, nutritionist.
That's it.
Is,
They hit her hard.
Oh, I'm sure
Yeah.
they did.
Yeah.
Yeah, they called me.
Well, you know, here's the thing. Because you're saying $30. So if you have 31 days. Yeah, they'll be back. They say they'll be back Saturday. Yeah. If I show up at the airport and they don't, oh well.
I got it. It's so good to see you.
Good to see you.
My sister left her coat, her hat.
Yeah.
Okay, number ends with 672.
Uh-oh.
Oh, is that
672. Last three numbers is 672.
Oh,